Hello, my name is Nicky Adrian. I'm a consultant child and adolescent psychiatrist and a senior lecturer at St George's Medical School. This is the second in a series of lectures that will introduce you to child psychiatry. In this lecture we'll be talking about preschool and middle childhood. The learning objectives are to think about the assessment of children at preschool and middle childhood, and then we'll be looking at some specific disorders, Autistic Spectrum Disorders and Hyperkinetic Disorders as examples of neurodevelopmental disorders, and sleep and conduct disorders as example of behavioural disorders. What happens in the preschool years? Children need to learn some control and gain some independence for their motor and body functions. They start to use language to communicate with others. They start to develop social relationships, both within the home and outside. But by far home is the most important environment to affect their development. When you assess preschool children, it is absolutely essential to know what is normal. Quite often you're one of the first professionals that come into extensive contact with the child, and your job is not only to pick out the emotional and behavioural difficulties, but to look at the child more globally. You need to know your developmental milestones, particularly those for social development, language and emotional development. At what age are children able to say 10 words? When can they communicate with people outside of the home? When do they start to play with other children? And what does that play look like? You are never going to get a coherent history from a preschool child. The details of the history you will get from the parents. However, you need to be able to engage a child enough for you to be able to assess their ability to communicate, their use of language, and their ability to make social contact. You need to be able to get down on your knees and have an extensive knowledge of children's television programs. Invariably, the child will have something about their person that will help you engage with them and start a conversation going. If they're wearing a red t-shirt, you may suddenly discover that your favourite colour is red too. They may have Bob the Builder slippers or a Power Ranger backpack. All of these will help you along. When you're in the clinic with your child and their parents, you have the ability to observe their interaction between the parent and the child. How are the parents able to put down some boundaries and guide the child? How do they interact with the child? Is there any emotional warmth? What you're seeing in the clinic is a micro slice of what might be going on in the home environment and may give you a clue as to what's going on. You're looking at the child's development, temperament, whether or not there may be any obvious medical problems, and trying to get some understanding of the social environment in which the child lives in, as well as the parenting skills or parenting style.